Cervical radiculopathy. It means a pinched nerve in your neck. So the nerve roots are these nerves that come out of your neck. Each disc, each motion segment has a nerve that comes out. The nerves have one number, C2, C3, C4, C5, which means cervical. Those nerves go to a different area in the arm. So where someone's pain and weakness and numbness is tells us which nerve is being affected. The C5 nerve comes out into your shoulder. It does your shoulder abduction, lifting your shoulder up. It also does half your biceps muscle. The C6 nerve comes out, goes down to the forearm, and goes to your thumb. So if somebody has pain going to their thumb, it's probably the C6 nerve being irritated. Then the muscle strength for the C6 nerve is the wrist extension, pulling your wrist up, and the other half of your biceps. The C7 nerve goes down your arm into your middle finger, and the strength is your triceps. We check your tricep strength for the 7th nerve, and your thumb extension is the 7th nerve. The 8th nerve comes down and goes into your small and middle finger. And the strength exam is lifting your index finger up, extension of the index finger, and the strength in your hand and your grip strength. So depending on where somebody's pain and symptoms and physical exam, numbness, weakness, tells us what nerve may be affected. Then we go back and look at the MRI and the x-rays and determine, is that nerve being irritated? Is it stenotic? Is it being pinched? And is that the source of the pain? So cervical radiculopathy means a problem, dysfunction of a nerve root. And sometimes it's multiple nerve roots. If it's just one nerve root, it obviously makes our job easier. And then sometimes surgery to go in and open up the hole for the nerve can help. So from a non-operative perspective, which is generally what we try first, please look at our video on the cervical rehabilitation of how to manage your pain and your symptoms non-operatively. But if that's not working or you have a neurologic deficit, then the videos that treat cervical radiculopathy, there's 3 different surgical options. One is to go from the back, do a cervical foraminotomy. We go in with a microscope. We basically open up the hole for the nerve and make more room for the nerve. The second surgery is a fusion, where we go in from the front, take the disc out, put a spacer in, and put a plate on and stop the motion and open up the hole for the nerve from the front. The downside to the fusion is it can put more stress on the other levels above and below. So the other surgery we do is an artificial disc replacement, where we go in from the front, just like the fusion, take the disc out, open up the hole for the nerve. Instead of fusing it, we put in an artificial disc that preserves motion. So all 3 are good surgical options. We do all 3. It really depends on each individual person's pathology as to what's best. So your options at this point are, 1, to email us all your information and we can help you decide what surgery may be best for you. info@watkinsspine.com to email us. The second option is to watch the video that best applies to your case, either the non-operative cervical rehabilitation program or one of the 3 different types of surgeries. Thank you.